Today I'm going to be informing you on the current health crisis in Yemen and what is being done to support the Yemenis during this dire situation. Yemen is the world's worst humanitarian crisis, with 80% of the country's population requiring some form of assistance to survive. What began as a local conflict in Yemen has developed into a 5-year civil war that shows little sign of resolution. The war in Yemen is a grave human catastrophe that has taken a massive toll on the most vulnerable individuals. In many areas, women and children lack access to the basic care to help them survive and live full lives. Today, more than 24 million Yemenis need humanitarian assistance. Yemen is located on the southern end of the Arabian Peninsula with long coastlines along the Gulf of Aden and the Red Sea. While Yemen is home to the largest expanse of desert in the world, its varied geography ranges from coastal plains to towering mountain peaks. The ongoing war has exacerbated Yemen's vulnerabilities. It is the poorest country in the Middle East and imports the majority of its food, leaving its people extremely vulnerable to conflict and blockades of its ports. Yemen's civil war has led to the worst humanitarian crisis on earth. The country has been locked in conflict since 2015, when an opposing group from the North Yemen, the Houthis, took over the government and initiated a war that has now bled across borders. The war has plunged Yemen into crisis, causing the economy to collapse, diseases like cholera and diphtheria to spread, and a health system already ravaged by years of political unrest to struggle under the weight of widespread need. According to Project Hope, last accessed June 24, 2020, 20 million Yemenis are food insecure, 19 million do not have access to clean water and sanitation, and the worst cholera outbreak in modern history has claimed more than 3,700 lives. The humanitarian crisis in Yemen has worsened significantly since 2015, due in part to a naval blockade on vital port cities that has left millions of people at risk of famine and facing the deadly threat of cholera. Though representatives from both sides have held peace discussions, as of yet no permanent resolution to conflict is in sight. Diphtheria, a vaccine-preventable disease, has spread as well, since displaced children have been forced to go without vaccinations. According to the World Health Organization, last accessed June 30, 2020, they have partnered with the King Salman Humanitarian Aid and Relief Center to ensure access to health care for the vulnerable individuals to remote areas through the provision of minimum service packages. The support has enabled them to sustain the health system at primary and secondary levels by allowing 293 facilities to remain functional and provide health access to 4.3 million people. To put all this information into perspective, the World Health Organization has provided this visual aid, which shows that if Yemen was 100 people, 74 would need humanitarian aid. 57 would have no access to clean water or sanitation services. 60 would be food insecure and at risk of famine. 10 of women and children would be acutely malnourished. 27 would be at risk of contracting cholera. And 53 would have no access to health services. This crisis has crippled an already weak health system, with only 51% of health facilities fully or partially functional, with a severe shortage of trained staff, medicine, equipment, fuel, and water. This has left the Yemenis' rights to health hanging by a thread, as nearly 19.7 million are in need of healthcare access. And now the already vulnerable people of Yemen are faced with the added threat of COVID-19. The coronavirus has compounded an already devastating situation in Yemen, with the UN now warning the deaths from COVID-19 could exceed all wartime fatalities. The spread of the virus has resulted in millions of people displaced and suffering from malnutrition, hospitals and health systems decimated, and limited testing and protective equipment. While no one in Yemen has been left untouched by the war, the country's women and children have been most affected, especially as malnutrition and disease spread. After 5 years of conflict, millions of people already struggling to meet their daily needs are now on the brink of starvation. Malnutrition has a compounding effect on children, as long-term impacts of growth and stunting, and makes them more vulnerable to disease. Meanwhile, Yemen's health system has been completely overwhelmed, with hospitals struggling to acquire basic medicines and supplies, while exhausted doctors and nurses work around the clock to meet the never-ending need. According to the International Committee of the Red Cross, last accessed July 1, 2020, they are working with the Yemen Red Crescent to improve access to health care with the donation of medicines and medical equipment such as gloves, compresses, and bandages for 3,000 people under quarantine. They have also provided personal hygiene items for 4,000 people in 7 quarantine facilities, which include more than 5,000 sets of waste management items and over 400 sets of hygiene materials such as bags, buckets, shovels, disinfectant, and almost 9,500 sets of house items such as blankets, sleeping bags, mosquito nets, and cooking items in 18 quarantine facilities. Their priority is to keep assisting people affected by conflict while taking all COVID-19 preventative measures possible. However, in a country with only half of its health facilities functioning, the International Committee of the Red Cross in Yemen, along with the Yemen Red Crescent, have been working to spread awareness and support different institutions on COVID-19 prevention and response. Ultimately, the greatest need for Yemen's people is peace. Until both sides are able to forge a lasting peace agreement, conflict will remain the root problem beneath the massive humanitarian crisis. Together, these alliances will engage local Yemeni organizations to focus on the hardest-hit communities where malnutrition and disease are rampant. Thanks to this work, food, medical supplies, medicines, and critical medical services will be delivered to people who need it most. In the longer term, these alliances will aim to empower Yemeni communities to support themselves with sustainable programs, focusing on rebuilding the health infrastructure and the capacity of Yemeni health workers. The objective is to save lives and eventually rebuild the healthcare system. For far too many people, time is running out. Thank you.